I'm Breanna Greenup, and this is a Garden Grove TV3 special news report. Today, we're talking about COVID-19 testing in this report, and I have with me 3 socially distant special guests remotely with me. We have our very own Garden Grove Mayor Steve Jones, Dr. Lynn Nguyen, and Mr. Vince Tien, co-founder of 360 Clinic. How are you guys all doing today?
We're doing great.
Doing amazing. Thank you for having us on.
So I'm going to start with you, Mayor Jones. There's a lot of talk in the news about testing. And I personally thought you only get tested if you have symptoms or you feel sick. But I understand there's a lot more to it than that. Can you tell us about why more people should get tested?
I think there's been so many mixed messages so far in recent months about what to do and who's supposed to get tested and not. And I think in the earlier days, maybe there was more of a supply constraint for the testing. And so people were reserving testing only for those who were sick or felt symptoms. But I think these days, the key is if we want to try and get through this, if we want to try and get back to a point of reopening our economies, then the general public needs to be tested. We need to get a higher volume of testing so that we can get a statistically significant amount of data showing that we have flattened the curve, and then that will allow us to reopen.
Mr. Tien, can you tell us about how you and the 360 Clinic have brought some big time testing in Orange County?
We started doing testing in Arizona with Dr. Lynn's group starting in March 2020, the beginning of the pandemic. And so we started doing testing over here in Orange County Memorial Day weekend, and then been doing church events since then. And then now we've proposed to the Orange County Healthcare Agency for our model July 1st. And we had opened Anaheim Convention Center on July 15th. So what difference is our model is that we provide clinicians on site, providers on site, to not only test patients and to deliver results, but to also call them up and follow up on them to make sure that we keep them home and alleviate a lot of the mild to moderate symptoms. Also, at the same time, alleviating the stress on the hospital beds and the ICU beds.
Can you tell our audience about the process of getting tested?
The website is occovid19.ochealthinfo.com/supersite. You register on there, giving out whatever symptoms that you have, inputting your insurance, and then also it would give you a confirmation email. You would come to the site, show your confirmation email, and you will be given a self-swab kit where our clinicians would be observing you to do the self-swab kit on site. Our results turnaround time right now, it's 24 to 36 hours, and the results will be delivered to you via email or text, or you will get also a call with our clinicians as well.
I also have a question. You mentioned you have to put in your insurance. What about, do you guys have an option for people that don't have insurance, or how does that kind of work?
Yes, so the government mandates all insurance to cover for the COVID testing right now. But if you don't have insurance, there's a federal aid out there called HRSA, and it helps cover people without insurance and people that are unable to get insurance as well.
Can you share with our audience how safe and easy it is?
The turnaround time, just driving through the site, takes about 10 minutes to get from your check-in to getting your swab done. It's a drive-through, so it's very, windows are all up, very low risk for the transmission between the patient and the provider as well.
Dr. Nguyen, thank you so much for being with us today. Can you tell us a little bit about your role in making the testing and the quick turnaround of the results available to residents of Garden Grove and the surrounding areas?
Sure. First, I'm in Arizona right now. I invented the model for home system. And the home system is not just doing the test, right? It's a physician seeing the patient, follow them wherever they are, making sure that you provide the best care possible. If you're positive and you have cough and you are symptomatic with fever, you should have a chest x-ray, then that's where mobile x-ray come in, right? And if you're an elderly, where you have a positive symptoms and it's going to affect your lung. Not only that, you need a mobile X-ray, you need a home health agency to follow you at home, right? And if you need medicine, someone need to deliver that medication at home. Just imagine the current model where you have to drive to pharmacy, pick up your medication at the drive-through, roll down the window, and then if you go to the X-ray clinic, you go to the waiting room and you go into the X-ray machine. All of that expose at least 10 people, you know? So with this model, we move the care to the home, right? So the moment you drive through the Anaheim parking lot or LC Fairground parking lot, and you have a positive test, then you need a provider to do telehealth and making sure you're doing okay. And if you need medication, they offer medication to the home for you. And if you need X-ray, we send an X-ray to the home for you. And if you're homebound because you're an elderly, then you need a home health to help you, right? Or caregiver to help you. So all of that can be coordinated throughout 50 states. And that's the beauty of the home system. So the home system is what I'm specializing in. To me, COVID testing is a great thing for the county. Everyone should be tested, right? But once you test it, the sick need to be seen. So let me give you a quick case scenario. We have, a case where we got a mid-50-year-old, 300 pounds lady going through, with fever and drive through the site. So to do it right, we got a wireless thermometer, we got a wireless blood pressure, wireless oxygen, and also the test, right? So all of that were done seamlessly. And we done it, to the perfection of measure to the time and the minutes. That's why I come in with, making sure the quality is there, the provider is there, and everyone is there.
Yeah, no, that definitely clears that up for me. It's amazing that you could kind of reduce exposure in the area by doing this. And you're also able to get the test back very quickly. Can you explain how that happens? Like, how are you able to make that possible?
I can take that one, Lynn.
Yeah, go ahead.
So we partner with multiple labs in the area, Southern California, to have high capacity. They're clear wave, high throughput, high complexity partner labs that, been partnering. Their capacity is about 80,000 tests per day. So as they to process that, so as they move up with getting new contracts, they can take it really quick. It's just a lot of the machines and then the efficiency of each lab. Yeah.
Okay, that makes sense.
Yeah.
Thank you for adding that. Also, Dr. Nguyen, can you explain what the COVID Physician Network is? And as a doctor, what are you seeing out there with the people in Orange County?
So it's a completely different dynamic between Democratic state versus Republican state, right? So in the OC Fairground and OC County, I see a lot of welcoming responses to help people with COVID test, and we have a great network of doctors coming together, and a lot of especially during this pandemic, 2/3 of the country, clinic being closed down, potentially going to bankruptcy if they don't have something new. So it's great to see those network endorse what we do and step up. And we're hoping with the network, the home system going to be even more powerful. So the quick answer to you is the response is overwhelming. I think COVID, depending on how you look at it, the doctor that we touch are, most are not doing well and very busy. But when we come in and partner with them, they're very supportive. And then they learn from us too. And, they turn their clinic into a COVID testing site also. So, so that's become more site available and more tests available to the community, right? Because not every doctor know how to do the testing. and to do it in their own office, is not. They can do it, but it's not as efficient in mass. So with this model, it helped educate them, and then and they come together and help us with telehealth, help us with the network, contract, help us potentially working with the IPA, Independent Physician Association, help us work with the managed care, like CalOptima, and the response is overwhelming. Yeah, from the provider standpoint, but from the payer standpoint, we have to go to hoops to get the contracts. Yeah.
Well, thank you. I'm glad we have the system around, because it sounds a lot more efficient than it was a couple months ago. Mayor Jones, do you have anything to add as far as the residents and businesses in Garden Groves with regard to COVID testing?
The businesses, particularly our small businesses, have been really hurting during this time frame with all the lockdowns, all the uncertainty of where we're at in that process and how quickly we might be able to reopen. So obviously I want to do whatever I can to help keep our community safe and get through this very real global health pandemic. But I'm very anxious to see our economy start reopening. I think testing is one of the keys to that. And I think the faster we can get hundreds of thousands of Orange County residents tested, then that will allow us to see a flattening of the curve over a statistically significant volume of data. And that's what will trigger the state level, the governor's office, allowing us to reopen more quickly on the local level.
Let's get tested and let's open our businesses. Before we end our report today, is there anything you would like to add, Dr. Nguyen and Mr. Tian?
I just want to add that right now we do have same-day appointments, so there's no waiting right now. So if anyone's watching this, you want to make an appointment to register, just go on our website 360clinic.md, and you can get a same-day appointment right away if you have symptoms or been close to anyone that has been positive with the COVID.
And from my standpoint, once again, the tests need to be offered to all public, all members at this time, and be available while we opening the community. The perception is, if I'm negative, I won't catch it again, is wrong. You should have a test at least every month, in my opinions. If you go to grocery, go to restaurant, you don't know when you're going to catch it again. So if you can just drive through one place, get a test in 10 minutes or, half an hour, and then get a text, in 48 hours to tell you whether you got negative result or not, I would do it in a heartbeat if I have it in close to where I live. This is a great service that the OC, Fairground, and the Anaheim and the county put together with the mayor. I think they have done an awesome job, and we appreciate the mayor and the supervisor and everyone to give us a lot of support to make it available to the citizen. I think this is a wonderful thing they have done for the community, so we appreciate it. From not only as a doctor, but also as a a potential upcoming OC residents myself. So thank you.
Thank you to my guests, Mayor Steve Jones, Dr. Lynn Nguyen, and Mr. Vince Tian. And thank you for joining us on this GGTV3 special news report. This is Breanna Greenup. Stay healthy and safe out there, and get tested if you have the opportunity. Until next time.
Drowning happens in seconds, faster than grabbing a snack. It's fast and it occurs without a struggle. Nearly 70% of young children who drowned in swimming pools were not expected to be near a pool. Drowning prevention is everyone's responsibility, and you can help by following these safety tips. Designate a water watcher, keep kids within arm's reach, avoid distractions, and never leave kids alone near a pool. It's up to us. Always watch the water.